Today we're talking about Arizona nursing home falls, when a fall is a red flag. Welcome, Josh.
Thank you, John. I'm happy to be here and glad to talk a little bit about falls and what we can do to prevent.
Absolutely. When is a resident fall truly unavoidable, and when is it a sign that the facility failed to protect the resident?
So, unavoidable fall is actually a medical designation. And so it happens when a couple of criteria are met. First, the fall has to be something that was a recognized risk. And then the home or the hospital, wherever the patient is, has to have put in place all reasonable interventions to address that fall. And then they also have to have adjusted that fall plan, as it's called, as the resident's needs change. And if those three things are done, then a fall can generally be called unavoidable. And that can mean that it's not necessarily the result of negligence.
So what should a proper fall prevention plan look like especially for a high-risk resident?
Fall care plans or fall prevention plans should be, and this is the biggest key, they need to be individualized. A lot of facilities will have just a generalized fall plan that attaches to all the patients that come into their facility. But that's not enough under Arizona law or medical standards. What they need to do is they need to assess the specific resident they're caring for, and then they need to say, okay, what does this person need? So it should be different for every individual. If you've got a patient who has, for example, dementia and has a hard time understanding what's going on around them or remembering things, something like a call light is not going to be very helpful to them because they won't remember to use it. If you've got a patient who likes to get up and move around and walk, then something like raising the bed rails is going to be a potential hazard that won't work to stop falls. And so what we need to do is really assess the individual patient or resident, and then we need to assess we need to see that they've assessed what they actually need. There could be a host of things, for everything from mats, kind of squishy mats in areas where falls are likely, to ensuring that there's caregivers around to assist with transfers, to checking in on the patient every 10, 15, 30 minutes to ensure that the patient has the help they need to get up and move around. But it needs to be an individualized care plan, and it needs to adjust as the patient's needs change.
And so after a serious fall, how should families use that assessment and care plan to figure out whether obvious precautions were missed?
So because it's an individualized plan, it can be really difficult. But what you want to know is you want to look and see what were they doing to try to prevent these falls, and what notice did they have that these kinds of falls were going to happen. If you had told them that your family member had a hard time walking or couldn't transfer by themselves, you want to look at the record and say, hey, did they have something in place talking about that need? If the patient had a tendency to wander or forget their limitations, what did they do to address that? This is a very complicated area of law, and so if there is a serious fall with an injury, a lot of times it also helps to reach out to somebody with expertise, like a lawyer who works in that area, to see if those interventions were actually done, because it can be very difficult to tell.
And are repeat falls an important red flag in nursing home cases like this?
Absolutely, yeah. So, one fall can obviously be catastrophic for an elderly person, but every time that a elderly person or a patient falls, you are basically rolling the dice to see if there's some kind of a fatal injury. And so repeat injuries are something that is a huge red flag. First of all, those falls should be giving notice to the facility that they need to change something to ensure that this patient isn't injured. And second of all, those repeat falls are drastically increasing the chances something serious should happen. And so they need to have, it increases the standards that facility or care home has to take care of that patient and to make special efforts to ensure that falls are prevented.
Right. So you should be seeing changes after each fall, that happens. The fall happens, and then they change the plan. They add something to the plan, and they say, okay, well, we need to address it, and so we're going to do this, this, and this. And then maybe, another fall happens, and they say, okay, well, we tried, but we need to increase it even further and change this and this and this. But if you're not seeing those changes after each fall, then you need to be addressing that.
Yeah, and that's true. So there should be there's kind of an escalatory ladder that these nursing homes or hospitals should be following to ensure that patients are taken care of. And that can go all the way from as low as just a reminder that a patient needs to be careful when walking around on their own, all the way up to fall mats, alarms. There are tabs or mats that can be placed that will alert nursing staff when a patient tries to get up or do something that they shouldn't. And then if that doesn't work, checking in on the resident in time intervals, and even having something called a sitter, which is a person whose job is to just sit there and make sure that this patient is not doing things that are unsafe for them. And those things can be really important, especially in the elder care setting where you've got patients that may not understand their own limitations and may just not get that if they try to get out of bed or they try to move, they're not going to be able to walk on that broken hip or that broken leg. And so in those situations, sitters can be important. And it's not enough to just say, well, we don't have them here. If they don't have the ability to care for a resident, you need to talk about whether the patient needs to be moved to a different facility with a higher level of care.
Are there records that an Arizona family might or need to, ask for right away after a serious fall?
You should always ask for records after a serious fall. Some facilities will give them to you and some will not. Some will show them to you on the computer, but you should always ask for records. And when you get access to those records, even if it's just visually on the computer, do what you can to document them, either by mentioning them in some kind of a writing, like a text message or an email to the facility, or by taking a picture of the medical records on the computer. The specific records you want to look for what are called incident reports or fall reports. There should be a little documentation about what happened, what they did to prevent it, and what they're going to change next time. Sometimes those are also called post-incident huddles or meets, but ask for any kind of an incident report or a response report to what happened. In addition, it helps to know what the care plan was for the patient at the time of the fall. And seeing that care plan and the items that they had actually listed on that can go a long ways to determining whether this fall in particular was preventable.
Have you seen any cases where a family was shown certain documents or reports, and then later on those documents or reports are no longer there when say a lawyer like yourself comes and asks for them?
Yes. So most hospitals or nursing homes will review their medical records, especially after a significant incident. And it is not unheard of, especially among some of the less reputable nursing homes in Arizona, that specific documentation will either get lost or disappear between the time that a family member asks to see the record and a lawyer later calls and asks for the record to be produced. There's also been situations that we've seen where a family member will take a picture of a part of the chart, and later on a nursing home will say that part of the chart doesn't exist, or even they'll produce a different version of that has additional care plan interventions or that has additional changes to the record that makes the nursing home look better. That's why it's very important to document what you're seeing in real time, because what you're seeing when you come in and talk to the facility is usually going to be the best and most accurate version of the record that we're going to see throughout the course of litigation.